Not everyone presents to a cardiologist with crushing chest pain. Yeah, that's the textbook symptom, but the vast majority of people have much more subtle symptoms. For those patients, they generally complain of just a change in exertional tolerance. What that means is maybe a month ago they were able to walk to the mailbox or carry a basket of laundry. Now, those activities result in fatigue or shortness of breath. You know it's time to see a cardiologist on several different occasions. One, some people like to see a cardiologist just to establish care. Maybe you have a family history or a personal concern. For other people, it's really based on a conversation with your primary care provider. They can help you determine when it's time to see a cardiologist. When you come to see a cardiologist for the first time, expect a conversation. There's a lot of talking that happens. We want to know about you. We want to know about your personal history, your social history. We want to know what your lifestyle is. We want to know what are the things that you want to do and what's preventing you from doing them.
There are three categories of testing that we do in cardiology. The first to assess possible rhythm problems is the resting EKG and ambulatory event monitoring. The second area is looking at structural disease in the heart, and that includes echocardiography and its variants. And the third, I would say, would be stress testing. The key there is looking for coronary artery disease or making sure a patient is safe to undergo surgery. One of the common problems we're looking at are disturbances in the heart rhythm. The patient often feels palpitations or racing in their heart. Sometimes all you have to do is listen to the chest with a stethoscope and you can figure out what's going on. But much more commonly, we'll do a resting electrocardiogram, and we probably do 50, 60, 70 a day in our department. Sometimes 20 or 30 seconds that the patient's rhythm is recorded on a regular electrocardiogram isn't enough. Myself, if I get palpitations, I could go months without having any. So we often ask a patient to wear what's basically an ambulatory electrocardiogram. Most people call that a Holter monitor or an event monitor. It's a device, something like our telemetry packs here at the hospital, that the patient wears home for 30 days. If their heart does go out of rhythm, it records that, wirelessly sends it in to us, and I look at it the next day. We're often wanting to look at the structure of the heart, and just one of the very best tests we have to look at that is echocardiography. Echocardiography is basically cardiac ultrasound, so perfectly safe, no radiation, no needles. There are some variations to an echocardiogram. Ultrasound doesn't penetrate air or bone very well, and that's the problem with doing ultrasound on the heart. The heart's surrounded by air and bone. So one of our tricks is to do what's called a transesophageal echocardiogram. Now, from the patient's point of view, this is pretty much like having an endoscopic test. The patient gargles with a numbing medicine. We sedate them. They swallow this echo probe, but instead of imaging the stomach like our GI doctors would, we're doing ultrasound of the heart. Now, why would we do that? Well, by imaging the heart from inside the esophagus, the swallowing tube, you eliminate air and bone, and so you can see tiny, tiny structures. The great American epidemic, of course, is coronary artery disease. So we do a lot of testing looking for that. And the key test there is an exercise stress test. That's basically looking to be sure that the electrocardiogram and the blood pressure response to exercise are normal. So you have the patient walk on a treadmill, increasing in speed and incline every 3 minutes until you get a target heart rate. Now, what you're looking for is changes in the ST segment or the T wave. Sometimes exercise testing is combined with imaging of the heart. So for example, you can do a stress with echo imaging. So there you're not only looking for EKG changes, you're looking for motion abnormalities in the heart with echo. A very common test is to combine exercise testing with nuclear imaging of the heart. This is a nuclear test that reflects blood flow to the heart. The idea is if you have a narrowed artery to the front wall of the heart, for example, you won't get radionuclide taken up by that part of the heart. Finally then, there are some people where we'd like to do an exercise test, but they can't walk adequately to get their heart rate up, or it's someone, say a hip fracture patient, who we're still worried about their heart. So that brings up the testing area that we call chemical stress testing. Here, rather than exercising, you give the patient a medication that increases blood flow to the heart artificially, and then you combine that with some sort of imaging of the heart.
The decision of whether you need a cardiac catheterization should be made by your cardiologist. So if you have certain symptoms that are suspicious of heart disease, that would be chest discomfort on exertion, shortness of breath on exertion, unexplained tiredness or low heart function on your ultrasound of the heart. So there's usually a reason why your physician, your primary care physician, does test to assess your heart, and there are certain things that would determine that you need a catheterization. Generally, the primary care physician sends you to a cardiologist who would evaluate your case and decide that you need a catheterization. The most common reasons to a catheterization are exertion-related chest discomfort, exertion-related shortness of breath, or fatigue that's unexplained that may have a cardiac cause, or if you have a low heart function that is detected often by a cardiac ultrasound. All those patients are candidates for cardiac catheterization. There are other reasons for cardiac catheterization as well, but this is generally the most common ones.
Appointments are easy. You can call our number directly and we'll schedule the first available appointment. Other people go through their primary care provider. This is a great opportunity to get some testing done before you even come to see us.